Don't get surgery for that shoulder until you know the options. Here's a pro tip. Most shoulder complaints, they don't need surgery, y'all. Hey folks, I'm Dr. Jeff Williams, and I'm the orthopedic specialist here at Creekstone Integrated Medical. And I want to share some surgery-saving information with you today. Information that can make your life and the life of your loved ones so much better. So make sure that they've got this information. They're going to appreciate and love you even more for sharing it. We love our shoulders, and the large majority of us know what it feels like when they give us some issues. Everybody, well, not everybody, but a lot of people have shoulder problems. And shoulder problems are so common because, well, the shoulder joint is the most movable joint in the entire body. Well, that means it can go in so many different directions, but we also sacrifice stability to allow for all of that free-ranging movement. And when we have less stability, we have more opportunities for injury and aggravation. We have patients tell us every single week that they have a tear in their rotator and probably need surgery. The worst of all, they say that their orthopedic surgeon told them that it's not a matter of if they're going to have surgery, but when they're going to have surgery. Wow. Which is a terrible thing to say to these people, by the way, and it can even lead them down the path into chronic pain. Just words like that and thoughts like that. But that's a different matter altogether. While there are rotator tears that can be problematic at times, most of them can be successfully managed without surgery. Lifelong management. Research recently shows that 75% of full-thickness rotator tears, like the supraspinatus, most common one, can be fully and successfully rehabbed with no surgery whatsoever. We know, and research proved, that movement is healing. Motion is the lotion for our joints. In addition, hurt does not mean harm. When people have just about any surgery, including joint replacement like knees and hips, people are up walking the halls within 24 hours. Movement is healing. These shoulder tears can almost always be rehabbed and strengthened and managed. No surgery, no cortisone shots that tear up the joints. Another issue is that research has shown us that most shoulder surgeries have never even been compared in research subjects to those that had no surgery at all. So they really have no ultimate clue as to whether it makes just as much sense to manage the shoulder through movement and rehabilitation without surgery. So, of course, we know that most can actually be managed and rehabbed successfully without surgery, thanks to research. At Creekstone Integrated Medical here, I use knowledge gained in my orthopedic fellowship training to assess shoulder issues and give effective treatment and targeted exercises to get them back in the game. When we supercharge it by adding low-level laser to the mix, treatment is powerful and it's effective. Besides tears, another big cause of shoulder issues is called shoulder impingement. Well, sometimes just some great exercises and some postural recommendations and alterations can make a huge difference very quickly. Most people don't realize that a huge portion of our shoulder movement, mainly it can come from our shoulder blades. And knowing this, I also explore the shoulder blade movement and address any dysfunction there. So most shoulder issues can be effectively addressed with our help right here at Creekstone. We do everything conservatively and non-invasively, but should everything we do still not help, then we pull out the hammer. No, not a real hammer, a metaphorical hammer, and we start treating through our nurse practitioner and our medical services with platelet-rich plasma, also known as PRP. Well, PRP is proven through research to be better and longer lasting for treating shoulder pain medically without being detrimental to the structures of the joint like cortisone and corticosteroids. So here are some quick examples of research conclusions. Here's the first one. PRP and Procaine were effective in treating frozen shoulder. PRP was more effective and had a more prolonged efficacy than the Procaine control. PRP injections were found to be effective in both pain and disability and showed improvements in a restricted shoulder due to adhesive capsulitis, which is frozen shoulder. Next one. Our study provided evidence of the efficacy of PRP injection in the healing of small to medium partial thickness rotator cuff tears. That's huge. Next one, patients with partial thickness rotator cuff tears or tendinopathy experience clinical improvement in pain and patient-reported outcome scores after both ultrasound-guided cortisone and PRP injections. Next one, patients who received PRP obtained superior improvement in pain and function at short-term follow-up, which is a 3-month follow-up. So that's just some examples, but we have so many options to help our patients get over their shoulder injuries without surgery and without more invasive procedures. So call us at 806-355-3000. Let's get you on our schedule as soon as possible. Let's get you back in the game. If you're watching us on social media, don't forget to share, like, subscribe, and comment. We love hearing your feedback. Until next time, again, I'm Dr. Jeff Williams with Creekstone Integrated Medical, and we'll see you right back here next week.